And today we'll talk to Dr. Rohit Sane about secrets to reversing your lifestyle diseases such as heart disease and diabetes naturally. Now, so far in our series of Livayu Talks, we've delved into various health topics like diabetes, joint pain, immunity, and many more. And in today's world, most of us live a sedentary lifestyle and follow an unhealthy diet. We've heard this again and again. And this has increased the prevalence of obesity and many lifestyle diseases, such as heart disease and diabetes. And it is prevalent, we can't deny it. While there are modern ways of treating these conditions, they often come with the risk of side effects and complications. And if you're looking for a natural alternative that is not only effective but is also safe for treatment of such conditions, then we're going to explore those Ayurvedic treatment options today. And to guide us better on the same, we have Dr. Rohit Sane here with us. He's the founder of Madhav Bagh and is an MBBS graduate from Aurangabad University and has a fellowship in cardiac rehabilitation from Apollo Hospital, along with a fellowship from the Royal Society of Health UK. He's the first to conceptualize the idea that Indian medical science, that Ayurveda can effectively treat chronic cardiac disease. He used his education in modern medicine and undertook meticulous research in Ayurveda. Extensive experimentation and delving deeper into every minute aspect of his study led him to find scientific evidence to substantiate his novel idea. The effort resulted in a highly effective alternative therapy for chronic heart failure through a combination of modern medical science and well established therapies prescribed in Ayurveda. So today we have the privilege of having him join us for this session. So Dr. Sani, thank you so much for being here with us and just diving into the questions directly.
Sure. Let's go ahead.
Sure. So Dr. Sani, what is the definition of lifestyle diseases and how are they different from any other diseases?
Okay. As the name itself suggests, that it's a lifestyle disorder. That means whenever my lifestyle goes for a toss, I would land up into some kind of disorders, and that would be called as lifestyle disorders. Now, if at all we need to have some difference between these lifestyle disorders and other diseases that we normally confront, normally everybody must be aware about COVID. So, COVID was a disease which was a communicable disease, which communicated from one person to other. It spread like anything, and it created a big havoc all over the nation as well as all over the globe. That is what we all know. But unlike COVID, unlike these communicable diseases, there are few diseases which are non-communicable diseases, but they are due to wrong lifestyle that a person normally follows. As
Okay.
you know, a normal communicable disease, which is an infectious disease, this normally spreads due to some kind of infections. But these non-communicable diseases, also called as lifestyle diseases, these diseases do spread because of wrong lifestyle that people normally follow. Like many a times you must be knowing about some kind of breathing disorders, like for example people normally have issues like smoking, or they have many more different habits like tobacco consumptions and all. They lead to certain kind of disorders like lung disorders, which can also get converted into cancer and more other things. As well, there are few other disorders like you can have diabetes, blood pressure. These would be certain disorders which would be called as lifestyle disorders.
All right. Okay. So makes sense. So whatever disrupts your lifestyle, we can consider that a lifestyle disorder. Now, what are some of the most common lifestyle disorders and how prevalent are they in Indians specifically?
Okay. The commonest lifestyle disorder that maybe everybody of us must be having at least one or two people in our house is going to be diabetes. And we all are aware about diabetes, that it has become so common nowadays that a normal layman would not know anything about medical science, but he would know something about diabetes or sugar ki bimari or something like that. So, if at all we actually enter into the figures, into the numbers of this prevalence of this disease, as of now, if at all we see, we have more than about 8 to 9% of Indians who are already diabetic. So, in a
Okay.
hardcore number, if at all we go ahead for, there would be more than 12 to 14 crore of people in India itself who already would be diabetic. And along with this, to add on to it, the equal number of prevalence would be people who are into pre-diabetes. That is, they have
Okay.
not yet been diagnosed as a diabetic, but they have all those symptoms due to which in the recent coming years they will be turning up into being a diabetic. So as a whole, if at all we see the diabetes as well as pre-diabetes issues, we have more than about 15 to 16% as a whole as diabetes prevalence in our nation. That is first. Second, the more dreadful disease than diabetes, but a lesser talked about disease, but a more afraid disease is hypertension.
Okay.
Normally, if at all we see, more than 21% of Indians are hypertensive. They
Okay.
normally have some of the other medicine that they use to control their blood pressure. And many a times there are certain number of people who don't even know that they are hypertensive. Many a times people have not even assessed or checked their BP even once in the whole lifetime. So it becomes very difficult to come to the exact prevalence of hypertension. But the second most commonest disease of lifestyle disorders is going to be hypertension. The first is diabetes. Now, these two diseases, the hypertension as well as diabetes, these two diseases are the most important raw material for the most dreadful disease that is called as cardiac disease. Everybody must be knowing about heart attacks and heart failure as well as cardiac arrest. All these are due to the raw materials that I just spoke about, that is diabetes and blood pressure. These two normal diseases, these two normal diseases normally get converted into a cardiac arrest or a heart failure or some kind of heart disease, which becomes very, very difficult for a person to manage. So that is the most third most important and to be known lifestyle disorder. And the most prevalent lifestyle disorder all over the nation is nothing else but obesity. And this
Okay.
obesity is nothing else but a raw material for hypertension and diabetes. So now if you just put on the sequence, the first starts with obesity, which is a raw material for diabetes and blood pressure. Diabetes and blood pressure is a raw material for heart disease, and heart disease is the most important disease. That is a national calamity for now, because if at all you see, the deaths in COVID that happened are not so much that we normally deal with heart patients nowadays every day. So, if at all you see, lifestyle disorders or else these non communicable disorders are more difficult to be managed than the communicable diseases.
Okay, okay. So that was quite some insight, and it was really interesting to know how these diseases can lead to the ultimate end of, cardiac arrest and heart attack, which we're all aware is deadly. Now, coming to Ayurveda, right? Like, can Ayurveda help with these diseases that we just touched upon? Okay, and if
Absolutely. I
so,
would,
how?
yes, yes, yes. I would rather say that it's only Ayurveda
Okay,
which can deal with these diseases, because if at all you have just read out my profile, I would like to put some light on that. I have done my MBBS, I have done my fellowship in cardiac rehab from Apollo, I have been practicing Ayurveda, and I teach in a homeopathy college. So if at
okay,
all I have understood all three pathies, and I have learned all these three pathies to the depth, and there is where I have understood that if at all I am supposed to treat a lifestyle disorder, I am supposed to rectify the lifestyle of that person. Now,
okay,
to rectify a certain person's lifestyle, I should have a standard lifestyle format which this person is supposed to follow. So, if at all I have to have a standard lifestyle format, there should be some science, some authentic information from which this standard lifestyle would be derived. When I've read all these sciences, what I've realized is it's only Ayurveda which has mentioned the actual lifestyle that a person has to follow. And that is the most important thing, why I consider that only Ayurveda is the science which has mentioned all these things related to lifestyle management. And hence I consider it's only Ayurveda which can treat these lifestyle disorders, and has been proven since a long amount of time that before the emergence of all these medicines that we normally use in allopathy, all these medicines are nothing else but a derivation of some kind of herbal formulation itself. If at all you talk about metformin, the most commonly used medicine in diabetes management by allopathy, that is nothing else but a derivation of a herb which is very equivalent to that of neem that we normally have anywhere on our roads. The second medicine, if at all you talk about heart medicines, if at all you talk about all these heart medicines, are nothing else but a digoxin kind of molecule, nothing else but it has been derived from ritpatri, from Ayurvedic plant. If you talk about the best acting antihypertensive medicine, it is nothing else but reserpine, which has been derived from sarpagandha, that is again from Ayurveda. So if you talk about any of the classes of medicine from allopathy which we normally use to manage these medicines, these are nothing else but a donation from Ayurveda itself. So it's nothing else other than Ayurveda which can solve this mystery of lifestyle diseases. And I'm sure that after learning all these sciences, I'll be able to take that step ahead to reduce down the burden of all these diseases from our nation.
Absolutely. Thank you, doctor, for that. And to learn that, a lot of allopathy or modern medicine has roots in Ayurveda itself. And that was an interesting learn. So, just touching up on diabetes real quick. Now, diabetes is so prevalent and it's been become so common that people don't actually understand how deadly it can be if untreated or if unidentified. So, can Ayurveda help reverse diabetes as a whole?
Absolutely. Now, before we understand whether Ayurveda can reverse diabetes or not, we should understand what do you actually mean by reversal of diabetes.
Okay.
Reversal of diabetes could be partial reversal, it would be complete reversal, it could be reversal in which the diabetes hasn't come back again in the life, even though after enjoying a lot with the wrong lifestyle also. There could be n number of definitions that people would like to put on to reversal of diabetes. But first, I'd like to clear that meaning of reversal. Reversal means, consider we normally take a parameter called as HbA1c, which is a 3 month understanding of your blood sugar level in your blood. That is the amount of sugar that has stuck to your hemoglobin in your blood. So if at all the hemoglobin is about 10 to start with, and from there, if at all the hemoglobin has been brought down towards 6.5 or below 6, then that would be called as reversal. Along with that, if the person has started with 10 and the patient has come down to 8.5 also, 7.5 also, that also would be called as reversal. But I consider reversal in this way, that the blood sugar should come down to such a level, the HbA1c should come down to such a level that it should be maintained at that level, and it should be maintained to a certain level where the liver is going to get completely empty from the stored glycogen, as well as the muscle which normally stores the excess amount of fat and glycogen in itself, that again should be empty, as well as a test called a GTT, the glucose tolerance test, that has to come to normal. And what is glucose tolerance test? It is nothing else but the person, a diabetic person, is supposed to consume 75 grams of glucose at a stroke. And
Okay.
after consuming 75 grams of glucose, this person is now supposed to undergo a blood examination after 2 hours, wherein the blood sugar is supposed to be found below 140 only. If
Okay.
that happens with a diabetic individual post the therapy, I would call it as reversal. And I am proud that because of us, every month we have more than 3,000 patients who normally reverse from their diabetes every month. So
Oh, wow.
that is how the diabetes could be reversed, and Ayurveda would be the best player to help anybody to reverse diabetes. So I am very, very confident that yes, Ayurveda would play a very, very important role if anybody wants to reverse their diabetes.
Amazing. That 3,000 number per month is honestly such an achievement. So congratulations, Dr. Sani. We're so proud to have you here helping us and sharing your knowledge with us. Like finally in this, so lifestyle disorders, as we discussed in the very beginning, is when our lifestyle is out of order. Now, we can all agree that due to our modern jobs and our modern lifestyle, life itself has become hectic, and it's really difficult for us to on our own try and bring about change in our lifestyle. And one main therapy that we know of is yoga. Yoga, we know, is beneficial, is in all ways. So how can someone find time and dedicate time to yoga? And are there any easy starter yoga poses that one can practice to get into fixing their lifestyle?
Okay, okay. I don't think so. It is so difficult so as to find time for any kind of exercise. I think, do we need to find time to breathe? I think no. So
Great
that's a
question.
continuous process. So yoga as well as exercises also could be a continuous process. And if at all you want to make it more simpler and you want to have certain yoga poses that anybody can do at any point of time, it's very, very simple. Normally, when we sit with crossed legs, you just have to put the lower leg on the top of the upper leg and upper leg on the top of the lower leg. If at all you do this, it becomes a Padmasan kind of pose. So that's the most easiest thing that everybody, we normally whenever we sit on the floor, we sit with our crossed legs. सिर्फ उसको उल्टा करके बैठना है. That is one. That would be called as Padmasan. The second process of the second yogasana could be like Vajrasan, and Vajrasan is nothing else but sitting in the namaz position. In some religions, we normally sit in those kind of positions. We are supposed to sit in that namaz kind of position. That would be called as Vajrasan. Again, in the same way, if at all you have to have a third yogasana, which is again easy to use, it's going to be nothing else but Paschimottanasana. Paschimottanasana means what? Just sitting in the right angle. You just have to straighten your legs, you have to straighten your back and sit in over in that position for about maybe about the maximum 5 to 10 seconds, not more than that. Now, whatever position that you are in, whichever yogasana you try out, the most important thing is going to be having good breathing exercises during that exercise pose. If at all we don't have those breathing exercises during this yoga poses, whatever I mentioned, the yoga would not be of more use than the blood circulation getting pushed up only. If at all we start breathing exercises, that is going to aid the mental tension also, as well as it is going to boost the dopamine in our body, which is going to again pull up more amount of blood supply and vasodilate the blood vessels, which is again going to help the heart as well as the other organs. So any yogasana pose that I just mentioned, there could be hundreds of more yoga poses that many people would be doing. But along with any yoga pose, if at all it could be gelled up with good breathing exercises along with it, that will be Sone Pe Suhaga. So that is all from my side about these yoga poses.
Thank you, Dr. Sani. So, main thing to remember here is it's not just about going out there and doing the physical poses, but it has to be supplemented with the proper breathing techniques as well. So, make sure you go to livayur.com and read more about yoga that's there. Now, we'll move on to some of our audience questions. So, Tushar from the audience asks, how does Ayurveda personalize treatments for individuals based on their unique body compositions or doshas?
Okay, okay. So if at all we talk about personalized Ayurvedic treatments, the personalized Ayurvedic treatments are not so difficult. As well, these personalized Ayurvedic treatments also could be on the basis of certain algorithms. Now, when we talk about personalized Ayurveda treatments, we have to talk about their typical doshas. Few people who come down to us are of certain category of diseases. Like for example, if a patient comes down to us with diabetes, normally Ayurveda mentions that diabetes, majorly the 10 different types of diabetes that have been mentioned by Ayurveda, they are majorly related to kapha dosha, while few of them are pitta dosha, few of them are vata dosha. So if at all we understand this well, and once we identify the patient in which category of prameha or which category of diabetes does he actually landed into, then according to that, the treatment about that specific type of diabetes could be initiated, keeping in mind which is the prakriti of this patient also. So a good combination of identifying the disease prakriti and then identifying the constitution of the patient also. If at all these two things can be gelled itself, personalized Ayurveda treatments are not so difficult. And we at Madhavbag have built n number of different protocols to mention that these 110 protocols that we normally have are very very specified on the basis of the weight of the patient, on the basis of the blood sugar of the patient, on the basis of HbA1c of the patient, and all these different criteria. We have even added the typical doshas that these patients normally have, and hence that has helped us to reverse these many number of patients of diabetes. And that is how we are going ahead. So personalized treatment of diabetes through Ayurveda is surely possible.
Absolutely. So, Tushar, I hope that answered your question. Kaustubh is wondering, are there any specific lifestyle habits or practices that an individual can incorporate in their daily routines to support this natural reversal of lifestyle conditions?
Surely, 101%. There are few habits that everybody has to follow. The first habit would be, normally any of these disorders, lifestyle disorder has a right sync with insulin resistance named disorder. What does it mean is there is hyperinsulin secretion in our body, which leads to insulin resistance, and that leads to lifestyle disorders. Maybe it is PCOD in females, maybe it is diabetes in males, maybe it would be childhood obesity, whatever it is. There are specific lifestyle habits that a person has to follow. And the first most important lifestyle habit would be, eat only if at all you are damn badly hungry. If at all you are not hungry to that extent, try to postpone your meals as much as possible. If at all you eat regularly, you make that insulin secretion come very often in your body, which nurtures the disease and harms you. Hence, the first principle to follow is going to be, eat only if at all you are that level hungry. That's all. That is the first habit that everybody has to follow. Second, the most important thing is going to be the sleep that we need to have in the night time. If at all everybody of us has a good sleep for about 6 to 8 hours daily every night, that is going to solve most of the problems. So that is going to be the second habit that we should have everybody with us. The third most important habit is going to be regular exercise early in the morning before your breakfast. So if at all you have regular aerobic exercises early in the morning before your breakfast, that's the third most important tip that everybody should have as a habit to keep these lifestyle disorders away. And the last and the fourth important habit that everybody should have is keeping this as calm as possible. Though whatever happens in this world, if at all we keep this as much as calm as possible, that habit we are supposed to inculcate in ourselves, that whatever we have maybe going through, we are supposed to keep our mind calm. And if at all we plan to have this habit done with ourselves for the whole coming new year, I am sure that the number of diabetics, number of hypertensive increasing per year is going to reduce down into 0 to 4.
Absolutely. So, audience, remember, number one, eat when you're hungry. Number two, sleep, get at least 6 to 8 hours of sleep. Number three, regular exercise before breakfast. And number four, it's not only important to have your physical health in check, but your mental health is equally important. So, let's focus on those 4 points to begin with. So, Sarvesh from the audience asks, can you discuss the role of stress management and mental well being in the context of reversing lifestyle diseases?
A very, very important question, Sarvesh, because if at all we talk about mental well being, that is the only thing which normally triggers the disease out in our body. Many a times we see there are n number of people who have all those bad habits which are normally called up for all kind of certain disorders, but they are never seen with those kind of disorders. The only reason is the mental status of that person was cool and calm, and no trigger had happened for the disease to be vented out. But if at all any kind of mental tension or any kind of psychological pressure that we go through, if at all we are not able to bear that in the right way, the disease would come out with that trigger itself. So as you said, it is very very important that to manage our stress regularly in our daily life is the most important thing. And what can be done to manage the stress? There are few typical tips. The first most important tip to manage your stress is going to be cut out all the simple carbohydrates that you normally consume. That considers majorly the things made up of sugar and milk. All these things need to form a huge amount of simple carbohydrates that we consume. If you consume more amount of simple carbohydrates, you will produce more amount of stress hormones in your body, and then managing the stress is going to be most difficult. So the first thing is going to be cut out all those kind of sugar and related things which are related to simple carbohydrates. That is one. Second most important thing, as I said earlier, is going to be good morning exercise. As soon as you start exercising outside your house, when you go out and try to exercise early in the morning, the amount of the hormones which normally vasodilate your blood vessels, they increase like anything, which again reduces down the stress in your body. That's the second most important thing. And the third and the last most important thing to manage your stress is going to be the free thing that everybody of us normally have, is nothing else but friends. The more number of friends you have, you will be managing your stress very well. You are supposed to just vent out whatever you have in your mind to your friends, and the stress disappears. Rest, we have n number of techniques, n number of ayurvedic medicines, n number of ayurvedic procedures which will help you to manage your stress. But these three things are free to do. If you start doing that, you will never need a doctor in the future.
Thank you, doctor, for that. And I hope we're all noticing that Dr. Sane is recommending very accessible, easy remedies that you can start right now. So do keep those in mind. Now we have questions. We have time for only two last questions. So Rishiraj asks, how does Ayurveda address the root cause of diseases rather than just managing symptoms?
Absolutely. Very, very typical question, Rishiraj. Root cause to be handled is very important. If at all we understand what has made this disease inside our body, that becomes the root. And if at all we directly try to get into that root, the cause of that root would be abolished, and that would lead to actual reversal of the disease. So how do we address that? It's very very simple. It's not a tough job at all. If at all you go back into the scriptures of Ayurveda 5000 years ago, they have done a huge amount of research, huge amount of science has been created by them, and they have already mentioned in their shlokas that what actually leads to these kind of diabetes or these kind of heart disease kind of symptoms as well as diseases. Like for example, if at all we talk about ayurvedic concept of diabetes, it has been already mentioned that navannapanam gudavaikrutam, as well as it has been mentioned that dadhini gramya udaka anupaha rasaha payansi. There are n number of things that Ayurveda has already mentioned 5000 years ago, that these things, if at all you start consuming in a higher proportion, you will land up into some kind of problems related to prameha, which can be very well acquainted towards diabetes. So if at all we are supposed to abolish the root of the disease, we are just supposed to follow that right lifestyle and continue following that right lifestyle. Because if at all you go back to the wrong lifestyle and again try to nurture the disease, the roots will again come up, and again it would form into the huge tree related to any kind of disorder. So if at all you want to abolish the root of the disease, it's not so difficult. Just follow those principles which your ayurvedic doctor would mention about, and you will be out of the disease for your whole life.
Interesting. Now, last question for the day is, Are there any specific herbs, natural remedies, or food recommendations in Ayurveda to help with heart health or managing diabetes?
Absolutely, there are a lot amount of herbs, there are a lot amount of foods that can be utilized to reduce down the blood sugar levels in your blood as well as to prevent heart disease also. Like for example, the best example that Ayurveda has already mentioned, anything that is amla rasatmak, anything that is sour in taste, anything that has vitamin C like content in it, everything is going to be hridya. It's going to be cardiotonic. So if at all you are supposed to improvise the functioning of your heart, you are supposed to have anything that is amla rasatmak, that is sour in taste. That is the first thing. The second thing, if at all you talk about diabetes, we know that if at all a person of diabetes is there, anything जो कड़वा जो अपने जीभ को लगेगा, everything that is not sweet to our tongue is going to help you to manage your diabetes. If at all you talk about certain specific herbs itself, there are n number of herbs. You can talk about neem, you can talk about gudmar, you can talk about kiraita, you can talk about bale. There are n number of herbs which will help you to manage your diabetes far more efficient than what metformin can do. Metformin, as I mentioned in the first part of my session itself, it is nothing else but a derivation of neem plant itself. If you talk about any other oral hypoglycemic agents also, they have all their roots from the herbal plants itself. So if at all you are supposed to manage your blood sugar with certain amount of herbs and food, this is surely possible. The earlier part in which I just mentioned those habits that you need to improve and the foods that you need to reduce down, if you just start doing this, managing these lifestyle disorders without a medical help will be surely possible.
Absolutely. So thank you so much, Dr. Sani, for that. And it's really interesting to know that Ayurveda is such an old discipline dating back to over 5,000 years ago, and it's rooted in practical knowledge and time and tested beliefs. And there is definitely an assimilation between our body, our mind, our diet, and our behavior. This forms the basic principle. And like you said, ahar, vihar, vichar, and achar. I hope I'm saying that right, but that is really where that is. Now, this unfortunately, this is the only time that we have for our session today. That was truly insightful. Thank you so much again, Dr. Sani, for
Thank
being
you.
here and for sharing such detailed and accessible information. I'm sure the audience has greatly benefited from it. And we do have a lot of other questions as well, but I encourage the audience to reach out to doctor personally and get that. I think we have time for one last question. um, Aditya asks, doctor, does exercising in the morning versus evening, does that have any difference? Because you did mention exercising before breakfast has a benefit, but does exercising in the late evening, how does that compare?
Lot amount of difference is there in between exercising early in the morning and exercising in the evening. Exercising in the evening is like slogging a dying horse. You are already out of your energy in the evening times, and the stress hormones are already active in your body because of n number of things that you have gone through for the whole day. If at all you exercise in the evening, the benefits that you get because of these exercises are going to be not as equal that what you get the benefits early in the morning exercise schedule itself. So in the morning when you start your exercises, you are free from all those daily stress, and the stress hormone haven't come down in action yet. Adrenaline and noradrenaline, named stress hormones, would come out in your body only after the first food bolus that you have in your stomach. So before that, if at all you exercise early in the morning, the amount of dopamine that would be secreted due to your exercises, the amount of blood vessels that would get vasodilated is going to be more as compared to what you will be having in the evening time. So I would always advise everybody to enjoy their exercises early in the morning itself, and that is going to helpful for everybody.
Absolutely. Thank you for answering that last question, Dr. Sani. Interesting insights. So, if you guys have any other questions, make sure to reach out to Livayo team, or you can also book an appointment directly with Dr. Sani. The information is in the comments below. Now, Our next session will be on January 12th, on cervical cancer and Ayurveda. With this, we'd like to end the session here. Audience, you can always visit Livayo website and follow our social media for regular updates on Ayurveda and the Ayurvedic lifestyle. Thank you again, Dr. Sane, for being here, and thank you, audience, for helping us help you.